Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. We're here each and every Saturday and Sunday, 10 to noon, on Pittsburgh Talk Radio 1320 WJAS. I'm Dr. Dennis Courtney, medical doctor and alternative practitioner, bringing you interesting topics, we think, every week. Interesting because, well, just doggone it, they are interesting, but interesting just not for esoteric purposes. We do what we are talking about, and I'm so excited to bring to you a new topic that we will be doing, and we're launching in December. It's a hot topic, folks. It is really capturing the interest of many people, especially those in chronic pain and with a whole host of other disorders, and I'm talking about stem cell therapy. Now, our guest today, Mr. Dan Popeck, represents a company called Surgilogics. I've researched high and low. I'm very much impressed with this company, and you're going to see why through talking to Mr. Popeck today. Let's say good morning and welcome aboard, Dan. Thanks for coming aboard this morning.
Thanks, Dr. Courtney. And yes, my name is Dan Popeck. I do represent Surgilogics, division of regenerative medicine, through the use of amniotic tissue-based technologies, and we've been getting some wonderful results helping people locally with pain-free post-surgically. And if it's okay with you, I'd like to start out how I recently got into the business.
But it's appropriate, very appropriate first question, Dan. How is it, because you've been in the industry for a long time, and I'm talking about the medical products industry, but you made a turn recently to Surgilogics, and when you told me the story, it really resonated with me, and I think my listener would like to hear, why is it that you're representing Surgilogics now?
Well, it was a great time for me personally and career-wise. I've been in medical sales, orthopedic, for 25 plus years, from the surgical aspect to the rehabilitation part, and dealing with people from total joint replacement trauma, including sports medicine injuries. It's been a very rewarding career for me. But I was attending one of our company seminars a few years ago, and while I was at the seminar, I'm a former athlete myself. I played league football through high school, Division I football, and 3 years in NFL that I tried out. And through those years, and suffering various injuries and fractures and the constant pounding on your body from the vigorous training and things, I developed pressure wounds on my feet. And what the pressure wounds attack is the weakest part of your body. So, having previously had several fractures and broken bones in my feet, I had a couple wounds open up, and while I was still going to work and going to the wound clinics and being treated for numerous years and not having it be able to be successfully closed, I happened to run into a gentleman from the Surgilogics company that said, he heard my story and my plight, and he said to me, if I could close your wound and unsuccessful with, would you represent my product? My comment to Tom at that time was, help me close my foot, get me back to a normal daily function, healthy. I'll come out, paint your house, touch grass. So he left the seminar. He was on orthopedics and sports injuries, and I was home for about a month. I didn't hear from Tom. It was the week before Thanksgiving 3 years ago. And Tom picked up the phone and gave me a call and asked how my foot was doing. I was very depressed, didn't go to work. My career was faltering because I wasn't able to carry a workload that I was being able to carry. And he said, well, if I send the product to you this week, and if I can close it within 2 to 3 weeks, you will represent me in your area. All I'm about to. So sent in the liquid, which I took to my wound doctor. I checked with him first. He said, have it shipped in. And the week before Thanksgiving, 3 years ago, the anniversary's coming up, I had my foot injected with the AmnioFlex, the SX fluid. And we followed the protocol, which is for wounds is a clean debridement to get out the scar tissue and the dead tissue that's associated with wounds. At the treatment, it took 15 minutes for it to thaw, to inject, and followed the protocol, stayed off it for 4 days, changed the bandages, and I had a rough scalp covering the wound.
Wow.
I hadn't had in years. I mean, it was just, I couldn't believe my own eyes, and neither could my family and my wife. And saw the wound doctor, he couldn't believe it, took pictures, and we wrapped it with a light compression bandage. Within 14 days, the wound completely closed with new tissue and healthy skin. No side effects, no pain, no inflammation. And it was a gift from the holidays that I sometimes get emotional about because, I mean, it's just utterly amazing the things that I've seen this product do for people for many different indications and diseases.
Well, Dan.
Go ahead.
Okay, that personal story, by the way, it's so typical that people have their epiphany based on something personally that happens to them. And it certainly is understandable. I think you told me you had the an open wound for over 2 years. Was I right about that?
Closer to 3.
Closer to 3. No matter what you did, and you had seen the best in wound care, nothing was closing that wound. And within 4 days, then by 14 days, completely shut. I can easily see why you switched careers and started to represent Surgilogics and have been a big proponent ever since. It is no surprise why you and I are talking today. Now,
absolutely. I was at the wound clinic every 2 weeks for those years. And they did try a lot of other products. So, like you said, I did see what I considered the best. Being in the medical business, you have relationships with any medical personnel. So you try and get yourself to the doctors with the best reputations. And quite frankly, they were stunned, and they tried a lot of the products that were out there that were industry acceptable. But until I had this particular treatment, they were not even close to successful to close a 5-centimeter diameter wound.
Well, your particular situation, personal to you, there are many people listening to us right now who are confronted with their own little personal agony, whether that's a wound that won't close or a joint that just won't feel better. These people are having agonizing discomfort each and every day. I thought it was really untimely, no, not untimely, very timely. This week on the Big Blaster here in Pittsburgh, KDKA, there was a special segment. I asked you if you saw it. You said you didn't. But I can tell you that a lot of people saw a segment that they did this past Monday. They promoted all last weekend, and they kept talking about this lady who had this miraculous therapy that gave her life back from a chronic pain problem in her knees. And so I was more than mildly interested in what I was going to be told. Tuned in on Monday, like they probably enticed a number of people to do, and this woman described how she had I'm going to say one only treatment of stem cells. Now, in her case, the stem cells were adipose. We'll be talking about the various forms of stem cells and why it is you might select one over another. But to me, the message was loud and clear. Stem cells afforded this woman the ability to have her pain problem resolved, like right now, one time with stem cells, and it said, that was perfect. She came on Monday, and I'm going to have Dan on the show on Saturday, and we're launching this program in the month of December. So this was good karma, Dan. Whether or not you caught it is neither here nor there. Many people did, and I've had patients that told me, they're my patients, told me they didn't miss it. Now, when it comes to stem cells, we really got to talk about the selection. We've been doing we do ozone therapy here, and I talked about that a couple of weeks ago. In conjunction with it, we have done something for a long time called PRP, very famous form of stem cell therapy, and practiced for quite some time and easily to be found anywhere in the city, I think. But there is a refinement and a sort of a hierarchy of picking stem cells. Could we have a discussion about the various kinds of stem cells out there, and then sort of end with the discussion on amniotic stem cells, because that's what Surgilogic represents, and that's ultimately the discussion we want to have on why amniotic over all others. Could you take that for a moment?
Yes, absolutely. PRP is the cellular-rich plasma therapy for regenerative medicine. Been around for some time, and regenerative medicine itself has really come to the forefront. Many doctors will call it stem cell therapy, many doctors will call it biologics, but basically it's finding a way to get the most powerful, best suited cells to help regenerate, whether it's soft tissue, as a cartilage, as a muscle, as a tendon. There's all types of, there's various PRP therapies. Adipose is something that they harvest from a person's belly fat.
Yeah, from fat.
And adipose belly fat harvesting is usually around 200 cc's, which is a high volume. And what they will do is they put that into a centrifuge and they attempt to spin down all the impurities and have a final product that they re-inject into the joint or area that they're hoping to heal, whether it be chronic pain, a tissue deficiency, a muscle deficiency, and in situations it has worked. Unfortunately, most of the time it can create one or more treatments. I mean, I did notice the patient on the television commercial stated she has one therapy, but sometimes one therapies include multiple injections. The volume of the fluid can be uncomfortable or painful for the patient. I think sometimes with PRP therapy, they can also spend a lot of time in the office, which is one of the things that our product really helps with. And aside from the adipose, there's also called bone marrow aspirate, PRPs, where they harvest it from the femoral bone marrow canal. And obviously they can't take as much volume from there just for the sole fact that you don't want to drain a bone marrow and strip it of its blood supply and cellular nutrients.
All right, here's what I want to do, Dan. We're just coming up on a break right now, and I'd rather, before you get into the next dimension of this, which I think we want to spend some time on, we're going to take a short break, ladies and gentlemen. We're talking about stem cells in general right now. We're ultimately going to be talking about amniotic stem cells. These, I believe, are far superior than the others. So take a break for news. Come on back. We're with Mr. Dan Popeck, and we're talking about a company called Surgilogic and amniotic stem cells. We'll be back in a moment to continue that conversation. Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you on this Saturday morning. We're talking about regenerative medicine, folks, and in particular stem cell therapy with an expert on the subject. Gentleman represents a company called Surgilogics that produces and packages and dispenses amniotic stem cells. And we're going to be talking about why amniotic in just a moment. But Mr. Dan Peacock told you about his own personal plight and how one injection, underline the word one, got him over a 3-year medical malady that none others could conquer. We were with you, Dan, just before we took the break. We were talking about various kinds of stem cells. We had discussed PRP, very common. You'll hear this on a Sunday during a football game where the announcers will go, so-and-so of a player will be down at the Southside facility tomorrow getting his PRP injection. A very well-known procedure going on for years. You also talked a bit about bone marrow aspirates as well as the adipose. Now, these are all autologous, and we're going to distinguish them between autologous and homologous. So with those two in mind, why don't you take it away and move into the next strata of stem cells, which would be the homologous type?
Well, the homologous type would be an amnion derived product. And if it's okay with you, I'd like to kick off with what is amnion.
Go ahead.
Amnion is the innermost layer of the placenta, which is harvested after a 5 healthy cesarean birth. The tissue is contained in fluid and membrane, aseptically collected, and sent to our processing centers across the Midwest for the special proprietary process to effectively clean, prepare, and preserve amniotic tissue. One of the things that the amniotic product is a great choice for tissue regeneration is it can simulate the delivery of growth factors, cellular response, collagen, physical scaffold on which regeneration can occur. Amnion is also potent, meaning it can differentiate into different types of cells, further setting it apart as a material. The nice thing about amnion, the safety part, is in the procurement and the processing. The donors come from patients within the United States. They undergo prenatal testing for communicable diseases, and through a thorough medical history review by a medical director. And again, it is then collected aseptically. A medical director determines if the donated tissues are eligible for transplantation, and the processing is collected, and the stringent proprietary processes follow the American Association of Tissue Banks and the USP guidelines to assure safety and potency.
All right, so
thing about
go ahead.
The main benefits of the amnion are 100% natural, or zero-age DNA, because being collected at the donor's childbirth, they're at the most pure, powerful age a cell can be. And the benefits, they reduce pain and inflammation. The growth factors to promote tissue growth potentially help call in the body's own stem cells. It helps reduce scarring. It's antimicrobial to protect against infection. And since the 1900s, where amnion has been used and processed through the years, and great growth and quality has come into play with the FDA approval, and the technology today is also the FDA calls this immune privilege. because there has never been a rejection of the tissue in any case or form.
No patient ever has shown signs of rejection. Is that what you just said?
Not one.
Not one.
Not evidence of one. Correct.
Okay.
They adapt, the cells adapt to patient that's being treated, DNA. 85% of those patients have one treatment and done. We're very careful in making sure of patient selection and the patient's expectations. Well, we've had a wide variety from osteoarthritic patients in their 70s and 80s to 20-something professional athletes, MMA fighters, weekend warriors, across the gamut. Surgically, it's being covered by private insurances because they are realizing the benefits in urology cases, OBGYN, spine cases, orthopedic cases. The progression and the understanding of how amnion helps people has just grown exponentially. And the other thing that they really try and do is make it affordable to the patient. Our treatments are usually after the consultation with Dr. Courtney would be approximately 15 minutes from thaw when the patient is walking out of your office.
Doesn't take long at all. Let me get and sort of backtrack two concepts that I think I'd want to elaborate on before we move any further. The first of them is the selection of cells and this distinction between autologous and homologous. Autologous literally means, ladies and gentlemen, that the material comes from you. And there's a lot of good things to be said about if it comes from you, because you don't have to worry about any reactivity issues when it's you involved. There's a problem with that, however, as I see it, Dan. I want you to comment on it, and that is the growth factors, the healing factors, all the cytokines are commensurate with the age of the donor. So a lot of people that I see with arthritic changes and degenerative joint disease, these are people of advancing age. And so the amount of growth factors and improvement factors in their PRP solution is much diminished when compared to, let's say, a 20 or a 30-year-old. And so this concept, I believe, has to be driven home to our listeners that you need the most vibrant, juvenile, and voluminous a number of healthy cells if you're going to accomplish this job. And many people are of such an age that their own autologous donation is a problem. Could you comment a bit on that?
Yes, Dr. Courtney, you're spot on. There's a few issues with it. A is age, because as you advance in age, let's just take a typical 20 or 30-year-old that is young, workout, vibrant, and healthy. Their cells are 30 years old. They're basically have been exposed to by their whole immune system their whole life, whether they've had other sicknesses, illnesses, other diseases. All these cells have been affected by their life. And obviously, as we advance in age, where we're paying, a lot of times we're treating 40 plus, 50 plus, 60 plus, 70 plus year olds, that comes into play even more often because, or more significantly, because of the amount of time that it's been exposed to their own immune system through the years, whether they were smokers, drinkers, flus, different types of bacteria, different types of flu symptoms, and things that transpire throughout a person's normal life. The nice thing about the amnion is it's fresh DNA. And in our cells, in 1 ml versus multiple hundreds of cc's in treatment, comparing it to some other options in regenerative medicine, in 1 ml of amnion liquid, we have over 1.5 million cells. Virgin, 100%, the extracellular matrix is naturally balanced from the human body. All the epithelial cells, mesenchymal cells, collagen, fibroblasts, laminin, growth factors, there's carbohydrates, proteins, peptides, lipids, lactate, hyaluronic acid, the cytokines that you had mentioned, which are very important to regenerative healing, are all at their purest point in life. Now, those 1.5 million cells, upon injection, what happens is it's like 36-hour evolution. 36 hours, those 1.5 million cells turn into 3 million cells. In another 36 hours, because they're so powerful, those 3 million cells turn into 6 million cells.
There you go.
And what happens is it keeps growing exponentially over time, which is why it's classified by the FDA and American Tissue Bank Academy as a viable option for regenerative medicine. And quite frankly, as you advance, what happens is you do lose 10% of those cells, of the first cells, because they do dissipate and die off. That's the life cycle of a cell. I don't want to get too much into the science or bore people, but the further you are advanced in age for the cell injection, the less cells in the less regeneration that stays viable to healing you, because what happens is those cells don't have what we call cell viability. PRP has promoted at times where some of their average cell viabilities, which is the power behind the cell, is anywhere, depending on age and immune system, if they were a smoker, if they were a drinker, if they had any other types of diseases through their life, of anywhere from 15 to 30%. Our average cell viability, which is tested upon donation and before it is sent out after processing, is 93%. We've never had a cell viability test under 93%. And what we're seeing with our product is advancements with clinicians who have PhDs in regenerative medicine. When they're doing these comparisons, they're speaking at a lot of medical conferences to clinicians and making them aware of the differences of the amnion.
All right, here's what I want to do. I want to, and thank you, that is really helpful. I thought it was a salient point in terms of the youth of the cells, the juvenile and aggressive and just healthy nature of young cells at that level. And it makes, in my own mind, amnion a perfect choice. Now we're going to take a quick commercial break. We're going to come back, and we're going to move to the other of the 2 points that I thought I can't let you go by without accentuating some additional thought, and that is 85% of the people that do this are one and done. And I'm going to end it right there because, to me, there's an exclamation point that deserves to be put right at that point. We'll take a short break. We'll be back with Mr. Dan Popeck talking about one and done. Okay, Dan?
Yes, sir.
Okay, be right back. Good morning, ladies and gentlemen. Welcome back to Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you on a discussion today, a very fascinating discussion about regenerative medicine. We're calling it Part 2, and specifically dealing with stem cell therapy. Its time has come, folks. It is hot around this country at this point to find the advancements in medicine that have such great promise behind them, and there's no greater an opportunity than to be able to repair and correct a chronic problem, whether that be a pain problem, wound problem, or you name it, through the use of stem cell therapy. We're talking about selecting what kind of stem cells, and the point of getting the youngest stem cells possible, I think, was clearly pointed out by you, Dan. I want to thank you very much. And that's why amniotic cells are such high up on my list of why I selected them compared to various other kinds of cells that I could have. The other point that I ended just before the commercial break was a statement you made, and you had made it in my office, and it really caused my ears to perk up like antenna. And that is 85% of the time, people who get these injections do this as a one-and-done procedure. Could you please elaborate on that and verify that you actually said that?
Yes, sir. Because we do a very good job of identifying patients, the grade of their fracture, injury, or wound, whatever you may call it, and their patient expectations, we have had a variously great results with treating patients with one treatment. And a lot of times, these patients are coming back to us. It is regenerative medicine. This isn't once-a-daily spot and use, or it's not like taking a pain pill or a corticosteroid. But what happens is the inflammatory response kicks in almost immediately, which helps with the pain receptors in your body, and the fact that it's antimicrobial, and there's no anti-immune responses ever reported because of the safety of it. I've had professional athletes, MMA fighters, I've had 70-plus-year-old osteoarthritic patients from knees, to hips, to shoulders, ankles. I mean, there's so many applications that this is being used in. This product is really new to Pennsylvania, but it's being used all over the country a lot more. I felt lucky for my personal use. You heard my story of coming upon it. But there's applications for this product in neurosurgery, orthopedics, internal medicine, podiatry and hand, plastic surgery, ophthalmology, dental surgery, urology, OBGYN, wounds and burns, general surgery, tendon repair, nerve decompression, and plastic surgery. But more on the pain side, which is pain is a great motivator to try and get better. We've done a lot with Achilles tendonitis and tears, ankle pain, sprains and instabilities, arthritis, that's degenerative.
We're gonna after our top of the outbreak, we're gonna get into the specific issues, and I just wanted to be certain that my listeners understood that this is the highest percentage of time, a one-time procedure in 85% of cases. That, by the way, caught my interest immediately, and I wanted to make sure you emphasized it. You did say to me, and you reiterated just a moment ago, that really, once you do this injection, it's going to be put right into the joint in question. There are 3 phases of response that this patient's going to move through. The first one is going to be an anti-inflammatory response, then the regenerative response, and then finally the pain receptors are going to be dealt with, sort of in that fashion and in that order. Did I get that right?
Yes, sir. That is what we've been experiencing locally. They've been experiencing this nationally for years.
So, by any stretch of the imagination, if you have degenerative joint disease, you've got the need for 3 things to happen. It's just there's no tool outside of these stem cells that can accomplish these 3 things, and this is why you battle with getting a resolution to your problem. Literally forever, it just doesn't happen. And so to think that there's a way to get this kind of response in 85% of the time with just one procedure, and okay, so it may take more than one, but nonetheless, I wanted to make certain that you heard about the one, and that this one set of cells, highly juvenile, highly active, pluripotentialed, are able to to regenerate new and healthy tissue in a place that had long since forgot about ever regenerating again. So this is the marvel of amniotic stem cell therapy, and why we're now launching, ladies and gentlemen, we are launching this program in December. If you think that you have an interest here, you want to make certain that you contact us to come on in and consult with us to see if you in fact really do qualify to have these kinds of procedures done. Our number here is 724-942-3002. That's 724-942-3002. So we can have a enjoyable time consulting over when your injection can occur for you. Now, Dan, we're going to be taking another break here, and I'm interested when we come back. I've been doing my research. You've sort of pointed me in the right direction on where to go, and I've come up with about 8 or 10 different unique points to amniotic fluid anyway, the use of amniotic fluid that, to the exclusion of all others, makes it far superior. And I thought I'd like to take the time to be able to run those by you. And then when we come back, also start moving into an arena of the specific problems that people who are afflicted out there that might want to consider this injection as we take it up to our end point here at the bottom of the next hour. Okay?
Yes, sir.
Okay. So there you have it, folks. We're talking about stem cell therapy. It is a reality here in Western Pennsylvania, and it's just the clinician needs to pick which form of stem cell they believe is the most advantageous to their patients. I say, after my studies here, it looks as though the amniotic approach is far superior. We're going to be talking about 8 to 10 different reasons why that's so. When we come back, we're going to cut for a news break. We will return with Mr. Dan Popeck on stem cell therapy. Be right back. Good morning and welcome back, everybody, to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney. The discussion today is concerning stem cell therapy, regenerative medicine, ways to be able to correct chronic conditions that just, well, really up to this point, have no real correction. And unfortunately, if you are afflicted, you know all too well about the agony of the symptoms that you bear up under. Hopefully bringing you a message of hope today through a gentleman who's really been instructional in my own awareness of how stem cells can be helpful. His name is Mr. Dan Popeck. He represents Surgilogics, and in particular, a form of stem cells referred to as amniotic stem cells. He's been our guest since the beginning of the show today. He's still with us. You still there, Dan?
Yes, Dr. Courtney, I'm still here.
Okay, well, we're coming around that home stretch today. We're in the last half hour of our show, and when we left, we were going to sort of have a agreement that when we came back, I wanted to go down through a list of what I believe really points to why amniotic should be the selection above all others. And we've already had the issue about, how healthy the donor is, and the age of the donor matters. And in terms of age, there can be no doubt that a recently delivered child and the amnion as far as, let's now tick through some individual things and give you an opportunity to comment. So number one on my list is that amniotic stem cells are supposedly immunologically privileged. What does that mean?
That means since the 1900s, there is not one documented adverse response or rejection. And the reason the FDA feels that is for the sole fact that upon the harvesting of these fresh cells, there is zero DNA attached, and it adapts to the DNA of the patient being treated.
Okay, so the big question, which I'm sure plagued many, is, my goodness, these aren't my own cells. Could I have a immunological reaction? Think it's pretty definitive. Not only won't you have one, no such reaction has ever been recorded, That's good enough for me. Let's move on.
Now, one of the things that the FDA does state, amnion's lack of immunogenicity is documented in a number of clinical studies and scientific journals, resulting in the placental organ being described as immune privileged.
Okay, so there's no, and then the fancy word, immunogenicity. There is no ability to provoke an immune response, which usually would be exactly what happens in any kind of a reaction. So that doesn't happen with amniotic cells. There's such a high, in amniotic fluid and amniotic stem, there's such a high concentration of stem cells. You talked about in 1 ml of your product, and by the way, that is unique to your product. I think that should be mentioned. Surgilogics has that standard. What is it? In 1 ml, you have how many million cells?
You have 1.5 million cells that differentiate themselves into what the patient's body needs. The type of soft tissue, muscle, cartilage, ligaments that may need repaired, whether it's a knee, a shoulder, a foot, a hand, an elbow, hip. We run an average of 93%. We've never had lower than 93% cell viability. Cell viability is the industry's way of saying that's power behind the cell.
93%. Okay. Another component, another positive, I think, about the amniotic cells is that they contain hyaluronic acid, and it's been described in simple terms as sort of like a joint lubricant. It's like the oil can, the Tin Man or Wizard of Oz. People are very familiar with hyaluronic acid and maybe never understood that is a lubricant is quite beneficial, and that's found in these cells. Is that correct?
Absolutely. It's the cell's own natural balance of fresh hyaluronic acid. I mean, orthopods have been using hyaluronic injections for a long time, but they are made in a lab. They usually are not harvested. That's what makes this a great option it's a natural alternative to synthetic, cadaveric, or animal-derived regenerative. I mean, I've heard comments that some of the products are from chickens. I don't know how true that is, but I've heard it more than once in certain companies. This is absolutely 100% natural.
Perfect. Now, there are a full complement of growth factors. It makes so much sense that amniotic cells would have them, but the full complement of them, all the growth factors are found in amniotic fluid and amniotic cells. I think that's another positive. Anything to say about that?
Well, this is what we call, it's all part of the extracellular matrix. You have epithelial cells, which is the very face of life itself. Mesenchymal cells, you have collagen type 3, 4, 5, and 7. Laminin, the fibroblasts and growth factors also include carbohydrates, proteins, peptides, lipids, pyruvate, electrolytes, enzymes, hormones. And again, the cytokines and the hyaluronic acid, they're all an important part balanced in that extracellular matrix, create the regenerative composition of tissue.
An abundance of growth factors, to say the least. Interestingly enough, in your own case, this next point more than likely hit home directly with you. Antimicrobial. These amniotic stem cells are antimicrobial. For a guy who had a wound that wouldn't close for over 3 years, you could speak personally about how antimicrobial that stuff was.
Well, antimicrobial is a way of saying that it battles infection. Infectious disease is infection is the leading cause of failure in any type of procedure, whether it be clinical or surgical. Once you have an infection, it starts damaging your body's own cells to be able to repair what needs repaired. And the fact that this is antimicrobial, it fights that option, and we have not experienced infection.
You've not even experienced infection post-injection.
No, sir.
Now see, every time.
Recommend if you have an infection, you can inject it to help fight the infection. We're not passive. We are aggressive at that point because the cells work so good. That is one of the outstanding benefits of the amnion.
Well, there you go again. Every time you speak, you sort of give me a new piece of this volatile information, and I'll take that and I'll file that one away. Thank you so much for adding to my education.
Very exciting.
It really is. Now, I want to really elaborate on this because so much has been in the news lately about fetal tissue and Planned Parenthood. I can't tell you. We won't have to get political here, but there are no ethical issues at all involving this amniotic cells. Will you please describe why that, in fact, is not a factor here?
Well, at the collection, the amnion is collected aseptically from donors after last cesarean birth. There is no harm to the fetus. Also, the medical director determines if the tissue is eligible for transplantation, but it comes from the placenta and the umbilical cord. It is usually discarded. If it's not a donor center, they literally throw it in the trash. And I think some birthing centers now ask parents if they would like to save that in case and the future of their child has any sickness that could help cure them in the future, and they cryopreserve them. I know some medical clinicians that was one of their questions to me at their own child's birth. It was presented to them by the doctor if they wanted to keep it and cryopreserve it because of the understanding of the benefits of the amnion.
So we have no ethical. This is not a matter of any harm coming to a fetus. The baby is already born. The placenta is then delivered, or in case of C-section, extracted surgically, and then the healthy baby is taken off to the neonatal unit or to the birthing room, and then your team takes over and processes that amnion immediately afterwards.
Yes, sir. And Dr. Quinn, to expand just a hair more scientifically, what happens is right before the birth, the child is actually in what they call Wharton's jelly. Wharton's jelly is the liquid around the actual baby, and it's protected by a blanket of chorion. Chorion is the natural barrier that protects the baby fetus from if the mother would happen to contract a flu or a cold or some type of disease during pregnancy to protect it and create a healthy child. We stop there. We remove the chorion. There is nothing that touches the fetus or embryo or however they want to term child. It is 100% safe, and there is no issues.
All right. Point is well taken. Point is well made. So here's what we're going to do now. We are going to take one final break, just a quick commercial break. And when we return, we literally are in the gun lap, around the corner, home stretch, and like to talk a bit about the various disorders you've seen now since you've been involved that have responded well to these kinds of injections. And I'm just going to guess now that listeners out there are going to identify with what you've seen. Fair enough, Dan?
Yes, sir.
Okay, here we are, folks. Let's take that short break. When we return, what would you be injected for, and how effective has those injections been in the past? We're going to learn that through Dan Popeck when we return. Be right back. Good morning, ladies and gentlemen. Welcome back to the Weekend Wellness Workshop. We're talking about stem cell therapy today, regenerative medicine, and a way to correct some chronic issues that may be plaguing you that you find no relief from. We had the opportunity today to learn quite a bit about it through a gentleman who ought to know. Represents a company known as Surgilogics. His name is Dan Popeck, and from his own personal experience, as well as what he's observed over quite some time now, he shared a lot of that with us. Danny, you there?
Yes, sir.
Okay. In this final segment, I thought it would be appropriate to end it by looking at some of the more common conditions, because stem cells can literally help in anything, but the same kinds of problems in terms of the numbers continue to come up. So I wanted to start walking down through a list. We've got to put at the top of this list the various forms of arthritides, whether it's rheumatic, rheumatoid, or whether it's osteoid, or whether it's just plain degenerative disc disease. There's got to be 3 top contenders for the number 1, 2, and 3 slots for regenerative therapies. Am I right about that?
Yes, sir. I mean, that is the highest volume that we have experienced locally and nationally is for arthritis. And that is why, hopefully, that a lot of these patients that are suffering from joint pain contact you and do a consultation, because the thing is, like I said, we're very careful on selecting. This isn't something that we ever want to be. We just want to do a good job with the consultation and the patient's expectation, because it is regenerative medicine. And people with osteoarthritic pain in the hips, shoulders, especially knees, is the number 1 indication that I've seen treated locally. And I've seen any from the ages of 40 to 80 where these injections have helped people significantly. And these are people that are calling, referring other people. So that is the one indication that really tells you that it's working, because they're telling their friends, hey, I didn't have to have surgery, because once you have a total joint replacement, there are limitations. People who just want to be out of pain for their common everyday activity really are people that we can benefit. People who are active. A lot of times people that are active are healthy. They like to work out, whether it's jogging, bicycle, golf is a big one. I've had a lot of golfers come forth, and it's just amazing the fact that we do an injection, and the next thing I know, I'm getting a call for a friend of theirs.
Oh, that's perfect.
A family member, where they're saying, we've had people that literally were diagnosed to need anywhere from total knee replacements to bilateral knee replacements, very active people in their 60s and 70s even, and they're doing an injection, and they just can't believe. A lot of them will look at me and say, why have you heard of this? What is going on?
Well,
and it's a lot of fun to be in that position to help relieve people.
I'll bet, and I'm just reiterating, when you talk about this large category of people who are interested in these injections, the 85% one and done rule applies here. I mean, it really doesn't matter to what degree they're afflicted. They know they have pain, but 85% of the time, one and done. Are you going to stick to that? That's an amazing statistics. All right, let's move on to talk about some of the other things that might be beneficial for. And, of course, the joint is one thing, but soft tissue in, around, or near joints are always up for grabs. Things like tendinitis, plantar fasciitis, ligament tears, tendon tears. The list goes on and on. How well do you do in the soft tissue arena?
Dr. Courtney, you're spot on. That is what we are most successful treating. The Achilles tendinitis and tears, brings an instability, the degenerative rheumatoid and osteobursitis, plantar fasciitis, neck pain, hand and wrist, tendinitis, tendinonis, sacroiliac joint pain, golfer's elbow, tennis elbow, post-operative inflammation following surgery or injury, soft tissue response that this medicine is fascinating.
Well, sometimes, I mean, if you're suffering from a pain in an ankle or a joint, you may even have confused whether it's coming from the joint or the soft tissue. But the fact that no matter where it's coming from, there is a resolution through regenerative medicine probably is the take-home message. Now, if you're already seeing doctors out there and they're quite specific with their diagnosis, literally, there's no diagnosis that should make you run away from this. This is probably something you should be running towards. How about that for a general rule to follow? You want to embrace this therapy and seek it rather than be concerned about, geez, I wonder if it's going to help me. I'm going to guess that the trials would be well to your advantage. What do you think about that as an approach?
I think it's a great approach because basically the neat thing about amniotic product, it's very versatile. And that it's so exciting to see the broad spectrum of indications and different applications that this amniotic product helps with. There's really, if it's a soft tissue defect of any type, I really recommend looking into this product.
All right.
It's a easy injection. It's very low risk as far as immune response. And basically, the only thing that you have to follow post-care is you limit the use of anti-inflammatories, including aspirin. And when we say minimize immobilization, we actually ask, let's just take a knee, for example, which is a very common area of pain, osteoarthritic. We actually encourage minimal mobilization. A protective active rehabilitation is recommended. It's not like surgery where you want to immobilize it. We ask that you limit the use of ice following the procedure because ice can damage the cells. Again, to understand the anti-inflammatory response and the way these cells divide to regenerate tissue, it's a fascinating thing to experience.
Well, this is a fascinating list. I mean, non-healing wounds, crush injuries, fracture healing. These could be major fractures to facilitate a much quicker response to complete healing. Salvage of limbs in those people who have gangrenous conditions, I'm going to guess, various cosmetic, plastic surgery. The list goes on and on. I'm really excited about this new chapter that we're about ready to turn, you and I, my friend. We launched this program in the month of December. By the way, unbeknownst to you, I've already got a couple people that heard that you were coming on, and they are listening to us, and they've already signed up. They want to be the first on the list, by the way, Dan. So there already is a list forming at the front door. I want to thank you for coming aboard today with us. Enjoyed the discussion very much, and look forward to working with you in the near future. You and your very famous company called Surgilogics, utilizing amniotic cells for stem cell injections. Thank you.
Dr. Courtney, we are very excited to work with you also to bring solid solutions to your patient's pain.
Okay, my friend, I'll be talking to you soon.
Thank you, sir. Have a great day.
All right, there you have it, folks. Mr. Dan Popeck, representative of Surgilogics, and been very instructive to us today on stem cell, amniotic stem cell injections to get these one and done. That just amazes me. They have been working in the chronic pain arena for over 20 years. I can't recall many times where one and done has ever been operational. Work very hard sometimes to get relief, sustained relief, but this one and done thing, it's going to continue to resonate with me. I enjoyed having you aboard today. Don't forget, if you want to schedule an appointment to see us, give us a call here at the office at 724-942-3002. If you're interested in the up-and-coming eye protocol, that number is at the Pittsburgh Eye Protocol at 724-993-0500. Up-and-coming guests, I will say, with other very interesting therapies are right around the corner for you. Keep on checking us out each and every Saturday and Sunday morning, 10 to noon. And then if you miss a show or if you want to go back, head to the website at djcmd.com. On the opening page, click on the icon marked Archives. That then takes you to my YouTube channel, and you can just scroll away all of my shows, every single show, from today's show all the way back to 2006 are on the site. I look forward to seeing you until next weekend. Until then, saying so long. Bye now.